all this talk unraveling the mystery of blood work. What do all those crazy tests mean? So when you're, are we on?
Yeah.
Okay.
Here.
So when you're a physician, when you go to a physician, he normally orders a panel that consists of two parts. There's a blood chemistry, and then there's this complete blood count, the CBC. Now, one of the things I'm going to say about that ahead of time, I use those tests. You can get a lot of information off those tests. But those tests, that's 1970s technology, okay? So think of a car that you had in the 70s where it had no seat belts, okay? Not a lot of safety features. So the blood work that you're getting, even though it does give pretty good information, it's not very sophisticated when it comes to really finding out some of the underlying issues of what's going on with people. So that's what we're going to talk about tonight. We're going to talk about when you get that test back, what do you look for? What do all those numbers mean? So let's talk about the first three: sodium, potassium, chloride. Okay, do you know, anybody know what those are called generally? Those three things are called? They're electrolytes, okay? They're blood electrolytes. So sodium, let's say sodium comes out high sodium, okay? Should be, okay, here we go. Should be about 140 to 144. So let's say you get a sodium that comes out at 149. What do you think that might mean? What's the chemical formula of salt, sodium chloride? So this person's probably eating too much table salt, okay? White table salt, not Celtic sea salt, which has all the minerals in it. White table salt, which is not good for you, okay? What about somebody comes in with a low sodium? Let's say they come in with a sodium like 130, which is pretty low, okay? That would be adrenal fatigue. Okay, so that person's losing way too much salt, too much sodium in their urine. They have a lot of stress somewhere in their life. That's adrenal fatigue. Usually when you see low sodium, you see potassium that's a little bit elevated, chloride that's a little bit elevated. So usually these three numbers are pretty consistent. You don't see real high sodium. I've seen real low sodium at times. Potassium you don't see too high. If you see a low potassium, okay, they might have adrenal hyperfunction, and they just might not be getting enough potassium in their diet. They may be getting too much sodium, not enough potassium. So the electrolytes are things that are pretty consistent. I don't see a huge amount of issues there with most patients. But occasionally I see somebody come in with a low sodium, and when I see that, I know I need to look at adrenal function. So another thing that causes low potassium is drugs, diuretics, like blood pressure drugs, and diets high in refined carbohydrates like sugar, okay, causes low potassium. Blood urea nitrogen. Blood urea nitrogen is you see it as usually BUN, okay? So blood urea nitrogen, when that's high, that means one of two things. Usually the person's either dehydrated or their kidneys are not working as well as they should. Blood urea nitrogen is how well are the kidneys filtering urea out of the blood and making urine, okay? When blood urea nitrogen is low, It can be low pituitary function or not enough protein in the diet. So what class of people would you say probably aren't getting enough protein, might come in with low blood urea nitrogen? Vegans, yeah. Vegans are unhealthy. I don't care what anybody says, they're not healthy, they never will be healthy. They're never gonna get enough protein. You cannot, there's too many vitamins and minerals you get in animal protein besides just the protein. So I'm not real high on veganism. You know, I think people become vegans for like moral or political reasons, you know, but they don't create healthy people. And if you're a vegan woman and you get pregnant and you have a baby, expect to have a lot of pain, a lot of tearing, a lot of bleeding, and a slow recovery. Okay, just expect that, all right? And a lot of doctors don't like delivering babies from vegan women because their tissue is so frail because they don't have enough protein to make good tissue. Another one you're going to see is creatinine. Creatinine really reflects muscle metabolism, or in a male, prostate and urinary tract function. So in a male, they come in, their creatinine is elevated. A lot of times, if you'll ask them, do you work out this morning before you have the blood taken? If they have, it's probably due to muscle breakdown. If it's really high and they haven't worked out, you know, they probably got some prostate issues they might want to get checked out. So that's usually what you see with that. Creatinine is not like one of the main tests that I see really skewed on a blood panel. So the next one is, okay, total protein. So total protein consists of two things, albumin and globulin. So when you see a blood test, you get a blood test back, you're going to see total protein, you're going to see albumin, usually globulin, not always globulin. So you add these two together, that'll equal this, okay? So if you just get total protein and albumin, you subtract albumin from total protein, you can figure out what globulin is. Now these are really useful figures, useful numbers. Protein, if protein is high, they may be getting too much protein in their diet, or they may have some muscle breakdown that's dumping protein into the blood. If the protein is low, usually if the protein is low and the BUN is low, so you have this is low, that tells me they're not eating enough protein. They got to eat more protein. If the BUN is normal and the protein is low, okay, that would tell me that they're not digesting protein very well. They probably need digestive enzymes to handle the protein better, okay? Which a lot of people do. Now, a lot of your tests are going to come back with what's called an albumin-globulin ratio, or AG ratio. This can tell you a lot, okay? So the albumin-globulin ratio should be about 1.2 to 1.7. That's the ideal AG ratio. Some people might go up to 2.0 on this, but this is what I've always been taught. So let's say you come back with an albumin-globulin ratio, like say that's 2.2, okay? That's probably someone who's dehydrated, okay? They come back with an elevated albumin-globulin ratio and their BUN is elevated, you know probably they need to drink more water, okay? But let's say They come back with their BUN is normal, and they come back with a albumin globulin ratio of 2.5. Okay. Then they probably have an immune system issue. There's something going on with their immune system. What if they come back with an AG ratio of, let's say, 0.9? That's pretty low. Okay. This is the kind of person that I know is not well. The lower the albumin globulin ratio, the sicker an individual is. And I saw my mother, I went out to California about 4 years ago. She got really sick, not even sure why. She was in the hospital for a while, and I don't even think that did her that much good, because the drugs they gave her almost killed her, you know. But I saw her blood work in the hospital. She had an AG ratio of 0.5. I was pretty concerned. You know, I thought, she's not well. Something is going on. Now, she's all better now, and now she got an AG ratio of like 1.7, which is really good. But when she was sick, it went way down. What I get concerned about is when people come into my office and they bring me lab work in from other doctors, and their albumin globulin ratio is less than 1, and nobody has ever told them anything, and nobody's ever said anything. So this, when you see something like that, that really needs to be investigated, because what's happening is globulin is going up, and globulin is a big part of your immune system. You ever heard of gamma globulin, immunoglobulins? That's what you're talking about with the immune system. So the albumin, when this ratio starts to go down and globulin starts to go up, you've got an immune system that's really engaged. There's something going on with that person. Doesn't tell you what it is. It just tells you you need to investigate that, whatever, okay? All right, so let's look at, oh, here it is. Let's look at blood glucose and A1C. How many of you know, how many of you ever heard of A1C? Okay. Can anybody tell me what it is?
In very rough terms.
Okay, tell me in very rough terms.
It's a measurement of how the person's blood sugars have been doing over roughly the last 3 months.
Very good. Yeah.
I have 3 diabetic kids.
Very, very, that's exactly what it is. That's not rough, that's exact, okay? Very good. It's what your blood sugar has been over the last 3 months. Another word for hemoglobin, A1C, is glycolated hemoglobin. So it's how much sugar has hooked on or combined with protein, okay? Now, you do not want high glycolated hemoglobin, because high glycolated hemoglobin ages you a lot, okay? It causes wrinkles, it causes organs to age. That's why elevated blood sugar is not good for you. So an A1C, I like to keep mine, I like to see it about 4.5 to 5.5, or 4, even a little lower, 4.0 to 5.5 would be the upper limit of this. And I had a little girl come in not too long ago. I think she's 10 or 11. She had an A1C of 5.7, okay? Now that, for an 11-year-old, that's just unacceptable, okay? And she was having problems. She was having skin issues and eczema and all this. So we had her mother brought her in, and you had a talk with her. We took her off sugar, all sugar, okay? Put her on some good supplements, changed her diet, and it took about 8 weeks, and it went down to 5.5, which was a nice change, okay? So hemoglobin A1C is a good indicator of what that person's sugar intake has been like over a 3-month period of time. I see patients come in with, I've seen it as high as 11, 11.5. You know, they're practically starting to crystallize at that point. You know, that's pretty high. So how do you bring down, how would you bring down a high A1C? Any suggestions?
Stop the icky white sugar and like carbs such as white flour.
Refined carbs, so you gotta get that out of your diet, absolutely. So that would be one thing. What would be some other suggestions? You've got to do that, you have to do that, exactly. Would be another thing that would help get A1C down.
Exercise.
Exercise, yes. You've got to exercise. And then I would recommend some supplements. You know, we have one called Glucose Sugar Balance, really good combination of several different products. Gymnema is a great herb to bring down A1C. Chromium, high chromium yeast will help with A1C, things like that. So I would definitely recommend that. Serum, let's see, serum insulin, okay? Probably one of my favorite blood tests of standard blood tests is serum insulin. So if your insulin is high, now we all know that we produce insulin, right? Okay. Where's insulin produced in the body? Pancreas. Do you know where else it's produced? No extra charge for this information, okay?
Probably adrenals or something.
The brain.
Oh,
is
The
it really?
brain produces its own insulin.
Oh,
Yes. Brain, okay?
wow.
So when you have high body insulin, that can screw up the insulin in the brain, and that can lead to what over time?
Alzheimer's.
Alzheimer's. Good answer. That's right.
Wow.
So serum insulin is related to diabetes, cancer, obesity, the inability of the cells to be sensitive to hormones. And here's another thing it does, and this is really important. It locks fat into the cell. So if your insulin is high, you've got to get that down if you're thinking about losing weight or getting rid of fat that you don't want. You've got to drop your insulin, okay? So how do you do that? Stop eating refined carbohydrates, you exercise, and you take the right supplements, because you will not lose weight unless you get that insulin down, because it locks fat into the cells. Now, the higher the insulin, the higher your chances are of getting cancer as well. So people that have chronically high insulin levels, your chances of cancer start going up. And that's research, that's been proven by research, that's not just anecdotal. And I had a patient here several years ago, he ended up dying of cancer, and he had cancer, and I checked his insulin, it was like 75. Now, insulin should normally, a really good insulin is less than 5, okay? That's what it should be. This was 75. And I tried to convince him that he needed to get that down, that this was, his high insulin was directly related to his cancer. And he was a great guy, but I don't think he believed me. He just could not grasp that concept. But we know that sugar feeds cancer, and that high insulin levels are associated with malignancy. So you want to keep your insulin levels below 5 if possible. Now, if you come into me, I test your insulin and it's 6.5, you know, I'm not gonna, you know, tell you, you know, you need to run to the cancer ward or anything like that. You know, 6.5 is pretty manageable, 7, but the higher it goes, the fatter you get, and the more chances you have for getting cancer, the higher that insulin. Calcium and phosphorus, okay? Calcium and phosphorus is your total supply of usable calcium, or calcium in the blood. And when calcium goes high, really high, I'll just give you the chemical formula for calcium is Ca. When calcium goes high, what do you think that means? Anybody?
Staying in your blood. going to the bones and the teeth, maybe?
Actually,
Not in the blood, in your soft tissue.
yeah, if the calcium, your blood calcium is really high. So normal calcium is about 9.3 to 10.5, right around there. So let's say you come into me, I do your blood work, and you come up with a calcium of 18. Okay? Now you can't take enough calcium to get that high. So probably what's happening is you've got a bone disease that's causing bone to basically disintegrate, and then all that calcium is going into your blood. So somebody that came in, their calcium was 18, I'd run some cancer tests on them or send them out for a bone scan. I'd want to find out what's going on with that person. Okay? So high, I've never seen anybody with calcium that high. Usually they won't end up in my office, they'll be in somebody else's office. But high calcium, not good. But I don't see a lot of patients with super high calcium. What happens if calcium is low? What would that mean? Low calcium. Let's say it's they come in with a calcium of 8.5. What do you think that would mean?
Well, they need to take more, right, or not?
Okay, what if they're taking calcium regularly, and they come in and it's 8.5? What do you think that might mean? Okay, so I'll tell you, they probably don't have enough stomach acid to digest and absorb minerals. So I would give them something like Zypan or something to help them up their stomach acid, digestive bitters, something to help them get acidic enough to where they can start absorbing calcium a lot better. Okay, let's get magnesium, okay? Magnesium is really, really important mineral. It activates over 300 different metabolic enzymes. It controls the hormones which direct calcium to the bones and the joints. Adequate magnesium decreases the need for more calcium in the body. So when your magnesium is at a good level, then your body doesn't need quite as much calcium. Deficiencies in magnesium can lead to heart problems, high blood pressure, and muscle cramps. Okay, so if you have muscle cramps, that's a classic sign that you have magnesium deficiency. Now, the magnesium, I just want to say this, the magnesium that I do on a blood test, I do serum magnesium. I'm going to be honest with you, it's not all that accurate. The accurate magnesium is whole blood magnesium. The reason I don't do whole blood magnesium because it would probably add another $100 to the test. And I'm trying to keep the price of my tests down. So I don't do whole blood magnesium, okay? If I feel somebody's magnesium deficient, if I'm getting that, listening to their symptoms, I just give it to them, okay? We don't need to do whole blood magnesium. We know it's probably deficient. Okay, let's talk about LDH, lactate dehydrogenase.
Which kind do you prefer? The citrate or the glycinate or the...
I use magnesium lactate. I like that.
Okay.
Glycinate's okay.
Okay.
I also use whole food magnesium called Easy Mag, which I also like. That's the one I personally take. But magnesium lactate works really well.
Okay.
So LDH, lactate dehydrogenase. When LDH is high, that usually means low mitochondrial function. When LDH is really high and climbing, that's like one woman called that, a woman I really respect, called it the poor man's cancer test. So lactate, when your body produces cancer, it throws off lactic acid. That lactic acid is metabolized by an enzyme called lactate dehydrogenase. So LDH, lactate dehydrogenase, when it starts really climbing, I'm starting to wonder if their body is fermenting sugar for energy rather than taking it through what's called the citric acid cycle. whether it's fermenting sugar, because that would throw off lactic acid. So I don't usually see it that high, but a high LDH usually means there's some sort of tissue destruction somewhere, okay? Low LDH, dehydration, it can mean low stomach acid, dysbiosis, excessive protein intake. And again, I don't see really low LDH very often. Let's talk about the CBC, complete blood count. Okay, so CBC, this is where you have red blood cells, hemoglobin, and hematocrit. Okay, and then you have, whoa, we had to have some excitement tonight.
You bet.
Okay,
You bet. Tell you what.
you're gonna just hold this up.
Yeah.
Okay, all right. That thing fell apart on me a while ago. Okay. Okay, Carmen.
I'll just make faces over the top.
Okay, yeah, you can do that. Okay. So we got red RBC, hematocrit, and hemoglobin. This tells me, you know, how much iron you have. Are you anemic or not? Okay. So if this is all really low, that tells me you're probably anemic, pretty anemic. If it's too high, you might be getting too much iron in your blood, or you may be dehydrated. All right. So if this is low, I will look at tests like iron, and my favorite is ferritin, which is a much more sensitive test than iron. And if these two are low, then I know that you got anemia, and we need to give you ferritin to get that up. Anemia is a big red flag. If somebody comes in and they're anemic, you got to fix that. You got to fix that before you fix anything, because nothing's going to work. People are anemic. You've got to fix that. Okay, so what about the other tests, like the MCV? You're going to see this. MCH, MCHC. Okay, these tests are valuable because when they're high, that means it's B12 folate deficiency. So they're either B12 or folate deficient. When they're low, it's anemia. So when you see these low, you're almost always going to see these low, and you know that that person's anemic. So what about neutrophils? You okay?
Mm-hmm.
Okay. Lymphocytes, eosinophils, and basophils. This is your immune system right here, okay? So when neutrophils are high and lymphocytes are low, you probably have a bacterial infection, okay? Especially if, well, yeah, I forgot to put monocytes. If monos are high, now monos, when they're high, you know the body's trying to clean up some sort of mess from an infection. So neutrophils high, lymphocytes low, I think bacterial infection, okay? When neutrophils are really low and lymphocytes are really high, then I'm thinking of viral infection or some sort of food intolerance. So we need to talk to the patient, ask them, what are their symptoms, and so they may have a chronic viral infection and not even know it. All right. When eosinophils, when they're high, that usually indicates inflammation in the GI tract. Okay. So high eosinophils and high basophils, or high eosinophils and high monocytes, these two, that can be an indicator of parasitic infection. So if someone has high eos, high monos, especially if they just traveled outside the country or they have lots of pets and they have a lot of GI issues and a lot of weird symptoms. I'm going to do a parasite test on them and see if they've got parasites. That's usually what that would indicate. Basophils, when basophils are high, high basophils means an allergy, infection, or toxicity. Yeah. Infection. One of those three. Okay. So when somebody comes in, their basophils are high. Again, I'll talk to them about allergies. We'll look at the neutrophil lymphocyte ratio for infection. And then I'll just talk to them about toxicity. It can be one of those three. Now, let's go to the next one, vitamin D.
Okay, wait, just one sec. Now, is that the immune system, is that part of a normal CMP or?
This is a normal CBC, complete
Is
blood
it?
count.
Okay,
CBC with differential.
Okay,
Yeah, this is always included in that.
okay, thank
Okay,
you.
again, 1970s technology right here, okay?
Okay,
The reason I know that, because I used to work in a chemistry lab in the 70s, and I used to run the chemistry machines, and this is what we used to do, okay? That's when a normal cholesterol was 350. Okay, let's look at Let's look at vitamin D. Okay, vitamin D, great test, powerful hormone. It really important for absorbing calcium, important for mood stabilization. It's an immune modulating hormone. So I want to tell you something about vitamin D. When I do a vitamin D test, we're testing 25 hydroxy vitamin D. Okay, this is not the active form of vitamin D. Really, the active form is 125 hydroxy vitamin D. So this tells us what's available, but it doesn't tell us how much is being converted in the kidneys, okay, to the active 125 hydroxy. So if you did a vitamin D test and you came out with a normal 25 hydroxy vitamin D, but the 125 was low, then you would know there's probably something wrong with the person's kidneys. Okay, that would be a way of looking at kidney function. Let's look at another one, HSCRP. Okay, HSCRP tells me how much inflammation somebody has. So they come in within the HSCRP is high, they're inflamed. Okay, HSCRP is normal, they're not inflamed. It's real simple. Okay, by the way, that little girl that came in with the 5.7 A1C, she had a pretty high HSCRP for a little girl. And once we took her off the foods that she was eating and gave her the supplements and the retest, HSCRP dropped. She had literally no inflammation in her body at all after that. A couple of other ones, TSH, thyroid stimulating hormone. This is the test that shows how much how much of this is produced by the pituitary to tell the thyroid to make T4 hormone. So TSH is not a thyroid hormone, it's a pituitary hormone that goes up when the thyroid is under stress and can't produce enough T4. We have a couple of other tests that I do for thyroid, TPO and TGAB. These are autoimmune thyroid markers, they should be done. Anybody has any hint of a thyroid problem needs to have those markers done to see if their thyroid issues are autoimmune. They're good tests. These probably weren't being done in the 70s. Okay, just so you know, that's not a 70s test. It's probably a 90s test. But very good test. And the last marker I want to go over, this is a pretty modern marker. You okay, Carmen?
Yep.
Okay. It's the last one, and you put the board down.
Okay.
All right. So TMAO. This is trimethylene N oxide. This is a pretty recent test, and I'm starting to use it. It's a very powerful test for looking at things like heart disease, your chances of heart disease, stroke, cancer, kidney disease. When TMAO is high, it can really predict the risk for chronic disease, especially cardiac disease. It's a better test than cholesterol, much better test than the cholesterol tests. It's much more accurate. And so I've used this test occasionally. I had a man come in, he was not well. Did his TMAO was really high, and put him on nutrients, changed his diet. 8 weeks later, we tested him. His TMAO had dropped to normal, very normal. Of course, he felt a lot better too. So this is a test that I would run on a patient that came in that was concerned about heart disease. They want to know what's my chances of getting heart disease or a stroke. I would do a TMAO, and if that's high, then we need to work with that patient. We need to change their diet, get them on some good supplements, get them exercising, and bring that down. This is I think this is an excellent test, and I'm going to use it a lot more. So here's what we're going to do. I always do a Bloodwork special in January. So all those Christmas cookies you ate, you can put that down. All those cinnamon rolls you ate, okay. If you want to find out what that did to you, okay. So we do a Bloodwork special in January. We do a comprehensive blood panel. Now that includes vitamin D, but that does not include TMAO or the thyroid, the autoimmune markers. If you want those, we can do them. They'll be extra, but normally our blood panel is $425 for the comprehensive. We do it for $299 in January. So all of January, usually we run it into February up to Valentine's Day. It's $299. So if you want to get that done, we're going to do that special starting in January. And it's a pretty good deal. So that includes a written report by me. You come back in, I go over it with you, includes a second visit, and I make any recommendations that may be necessary. If you want the TMAO done, which should be good, that's probably going to be about $50 extra. I'd have to look it up, but that would be extra, be worth doing. Okay, but you can find out what your markers are, and then act accordingly. So that's what we're going to do in January. So if you know people that need this done and that need a comprehensive blood panel, this would be a great time to send them into the office so we could do that. So does anybody have any questions over what I've done tonight, what I've talked about?
Does that have to be fasting?
Yes, it's a
And-
fasting test.
And is it drawn here in the office?
I draw it.
Okay, you do
Yeah,
that.
I draw it.
Okay.
Yeah.
All right.
Unless you have just absolutely abysmal veins, which, I'm pretty good at drawing blood, but there's a few people I haven't been able to get. So, yeah, I draw it here. Yeah, and it doesn't take long, and it comes back within a week. We've got it, and it's all written up, so it gets back pretty fast.
Now, do you have a list of what all things would be included in that test?
Yeah,
I do.
Carmen's got it.
Okay,
Yeah, I do.
wonderful.
Carmen's got everything.
Okay.
I don't know about that.
Very good.
So we're scheduled for our annual physical in February that does a blood draw and does the blood test. Would this thing be, what you have be more beneficial than
Yes.
It's gonna be more comprehensive than what you're gonna get, yeah.
And you're,
So we should have you do it and take it into our position and say, hey, this is,
Actually, you should have me do it and then let me explain it to you.
well,
Yeah,
yes.
I mean, you can take it into
Yes.
your physician, but you're gonna get,
well, I understand that.
Yeah.
I mean, we could take it into him and say,
Sure.
in lieu of having him do another blood
sure,
test.
you can do that, just take it into him.
Yep.
Yeah, cause you go to Grinstead, right?
Yes.
Yeah, well, he would know what I do, you know. Nice socks, by the way.
Oh, thank you.
The Christmas spirit there, you know.
Actually, I got these at the blood bank.
I gotta get them somewhere, you know.
I made enough donations that they handed them out.
Good for you.
Yeah, we
All I
haven't
ever
ever,
got was t-shirts.
oh. I threatened him to bring home another
I'm
t-shirt.
working on 17 gallons right now.
Wow, that's pretty good.
my.
That's really good.
Wow.
Yes, he does a good job
You have
of,
lots of t-shirts.
drawing your blood. I don't think I even had even a tiniest little
So one
spot
thing,
in
I think
that.
when I had my physical a year ago, my iron
Yeah.
levels were a little high.
Mm.
And I hadn't donated blood,
Which was high?
my iron
Oh.
levels.
Oh, iron levels?
Yeah. And normally I donate like 6 times a year, so 5 or 6 times a year, so. And when I told Instead that, he was, okay, that makes sense.
Yeah, okay.
But I hadn't given for a while, cause I caught a cold in January, so I didn't donate, and then I had my physical in February.
Yeah, so if you'd done it like, a week after you had the cold, you'd have seen your immune markers skewed because of that, for sure. So the next talk I'm gonna do is on the 12th of December. It's on Alzheimer's. And then on the 19th, we're gonna do nutrition and inflammation. And then we're not gonna do anything else till January. And I have 3 new talks in January I'm gonna do. I'm gonna do one on understanding the healing the nerve that influences emotions, anxiety, depression, and visceral function. I'm gonna do one on why people can't heal. It's completely new talk that I'm gonna do. And then I'm gonna do another one called the relationship between organs, muscles, and nutrition. That's gonna be a real interactive test, really, a real good interactive talk. So that's coming up in January, February, and March. So Alzheimer's, 12/12. I've got some really good information, some really recent information on Alzheimer's. So we'll talk about that then. Any other questions?
What did you say about the 19th?
The 19th,
Of December?
yeah, December, yeah. It's
Oh.
nutrition and inflammation.
Okay,
So that's the talk I'm gonna do then.
okay, so this is every week you do?
Every 2 weeks.
Usually every other week, but December because of Christmas and New Year's,
right.
I did 2 weeks in a row. So then,
Okay.
we don't do anything else till the end of the year, So
Okay.
then brand new year, brand new talks, for next year. Good,
Very good. Thank you.
Yeah.
This was excellent.
good. Sorry, I don't know what I'm gonna do
It's-
if I can't get my computer to work.